this is what rural California needs, and this is what we're delivering on today.
Thank you. I wanted to know, Senator McGuire, in regard to Sempervirens getting refurbished or rebuilt? Rebuilt. Okay, so it's a whole new building site.
Yeah, $43.5 million.
Yeah.
Sempervirens will now relocate into downtown Eureka.
Okay.
We're also going to be adding 4 additional crisis beds into Sempervirens. This has been a vision of the County of Humboldt. Candidly, Sheriff Honsal, who I'll ask to speak on this as well. But look, if an individual were to see what Sempervirens looks like today versus what it's going to look like in 2030, it is going to be night and day. I'll say this, the sheriff may not, but it is very difficult to recover from a psychiatric crisis when you are in surroundings in which Sempervirens how Sempervirens currently exists today. It will be a modern facility with modern technology. It will be safer for the staff team who will be treating the residents, and we're expanding its capacity. This alone is a massive improvement from where we've been for decades. Sheriff, if you want to talk about Sempervirens, because having a brand new facility is going to be a game changer for the county.
I mean, what we have right now is a facility that is, 60, 70 years old. I mean, can you imagine that? And then
Cold War era.
Yeah, absolutely. This is a facility that wasn't really originally designed to treat mental health, patients, and especially those that are in crisis. So when we have a brand new facility with all of the programming space, with all the therapeutic space, including staff, it is going to be, basically a game changer like we talked about. We're going to be able to put people back on their feet, to provide therapy and provide those essential functions so that they can actually get back functioning again. And that is the goal of it. And so we're really, really blessed to have that coming into to Humboldt County, because it is definitely necessary. I mean, right now, the biggest mental health facility that we have is our jail. And, we have limited beds for those that are declared incompetent to stand trial. The other ones that are declared mentally, insane sometimes are in an isolation cell. And how therapeutic is that? It is not therapeutic once, But one of the other things that Senator McGuire touched on constantly is this continuity of care. From the hospitals to Sempervirens to the correctional facilities to social workers on the street, when we can be able to identify people and then get them into a program, get them into space, Sempervirens may not be the right space for them. It may be, another facility. Being able to do that kind of personalized treatment and care is really what's necessary. And to have 101 beds, for this kind of purpose is just going to be really just really huge for our county. And our
a bit of a game changer?
It is going to be a game changer.
Yeah, and look, the reason why Providence and Mad River are such big partners is if you were to go talk with their nursing department, there are 2 ways that folks who are in crisis can seek care. Either in an emergency room, which we know simply does not work, or they end up in the Humboldt County Jail. We are not going to solve our addiction crisis that strikes America, or the mental health crisis that strikes America, in a jail cell. We need competent staff in modern facilities, and that is exactly what this investment is about. We've gone from just a handful of beds 3 years ago. Fast forward in the coming few years, 101 total beds focused on results-driven mental health and addiction treatment. And that's what we need.
Yeah, let me just tell you, one of the things that we haven't really touched on is the fact is that the hospitals are overwhelmed. They're overwhelmed. So if you're trying to seek treatment, for a normal issue, whether it's a broken leg or a heart issue, you're standing in line behind the other people that need to be mentally health, triage essentially.
Right.
And so that's a huge deal here. So some people say, I don't care about mental health beds, it doesn't affect me. Well, let me tell you how it's affecting you. Try to go to an ER on a Friday or Saturday night. It is absolutely ridiculous trying to get help in our facilities because, it is overwhelmed the medical system here in Humboldt County.
Right, and to your point, it may not be a medical illness, it could be a car accident that
True.
lands somebody.
Yes.
It could be a total
Trauma. Absolutely.
accident is circumstantial, where you end up in the ER by no fault of your own and still are waiting in line for
Yes,
basic services.
and that's what's happening in the ERs right now.
Sorry, last question. We have to get the senator moving. I apologize.